Hi, this is Dr. Pramudji with Houston Female Urology, and today I'm talking about leakage when you exercise and what are your treatment options. So this is something that you may experience when you try to jog or do jump rope, jump on the trampoline, do any kind of strenuous activity where you will have some little bit of urine that comes out. And it can be very distressing, and it can even start to affect your ability to enjoy your exercise, enjoy your life, because you're always worried about it. So we do have some really good treatment options that I want to tell you about. First of all, the non-surgical option is pelvic floor muscle toning. And when you come in, we will evaluate your muscle strength and give you an assessment of if you've got any room for improvement on your muscle tone. And that's something that I would highly recommend working on first before surgery if you have the time and the inclination, because that can make a really big difference and could help you to not have to have surgery. We have a great program here in the office. My staff is very well trained on pelvic floor toning, and we have really good results with that. Okay, now let's say you don't have the patience or the time for that, or you just want to get it fixed, or you've tried it and it doesn't work. So what are your surgical options? The number one option for stress incontinence, which is leakage with exercise, is the sling, which is the TVT sling. TVT stands for tension-free vaginal tape, and this device is literally like a piece of Scotch tape, and it's made from sutures that are woven together, and I place it right under the urethra. It's not a bladder lift at all, it's more of a urethra lift, and it goes up around the urethra. And then what happens is when you then exercise, the urethra will push against that tape and close the channel for you so that it'll stop the leakage. This is considered the gold standard by the American Urological Association, the American Urogynecological Society, the International Continence Society, and I could go on. It's extremely safe, very effective. It's going to be effective in about 90 to 95% of patients. The side effects are minimal, the risks are minimal. There's a small risk of pelvic pain afterwards, a small risk of vaginal mesh exposure if the vaginal wall doesn't heal. And there is about a 5% chance that your bladder won't wake up immediately after surgery, and then you'll go home with a catheter for about a week, and then we'll take it out, you'll be fine. We'll get you through that. The other kind of sling is called autologous fascia, and it's made from your own body wall. And that was done 20 years ago before the TVT came out. We still do it occasionally. I'm very familiar with the procedure. I do it quite frequently. The reason we don't do it every time is because the risk of catheter goes up. So that is more uncomfortable for the patient, and it has more of an incision in the lower abdomen than the TVT. But it is an option, and for some people it's the best option to really cure their problem. Another treatment option is called bulking agent, and the one that I use most often is coaptite, which is injected into the urethra to bulk it up, kind of making a tighter seal in the track. It's not as durable as the sling, so we don't do it as often, but for some people that's exactly what they need. So those are your main treatment options for stress incontinence, and if you have any questions and you'd like to be evaluated, please check us out, give us a call, or find us on the web at houstonfemaleurology.com. Thanks.